Hello. So my name is Igor Gorlatov, and I'm with Kepler team. And thank you to all of you brave souls who are staying after lunch and after another presentation after lunch for this next segment, which is a little bit different because it's in partnership with Tech Talk. This is the community event that Kepler team has been organizing for several years. And this year, we're excited to partner with Health Innovation Summit with Dan and Ashley and the rest of the team to put this event as part of a larger innovation summit. I think the health tech ecosystem has some work to do in terms of catching up with the fintech side of things. But I think we're making progress, and we're excited that these collaborations happen. And what gets me even more excited is having a great panel that will be part of our Tech Talk today. The panel will be moderated by Neeta Kirpalani. She's a strategy manager at Novant's digital health and engagement team. She is responsible for sourcing and implementing emerging technologies, and she's also overseeing large-scale innovation initiatives, such as autonomous drone delivery with Zipline. Without further ado, I'd like to welcome Neeta and the panel to the stage.
So scary to ascend the...
You made it.
Did it. It's pretty terrifying. It's okay. You guys will be you could keep our secret if we fell. Go ahead.
Yep. No. Thank you, Igor. Good afternoon, everyone. Thanks for joining us. Today's Tech Talk is focused on moving towards consumer-centric care and healthcare, borrowing ideas, technologies, and best practices from other industries. Joining me today are Michelle Schemerge and Bryan Dennstedt. You can please introduce yourselves.
Sure. Good afternoon. Thank you for staying. I know this is probably pretty painful. Hopefully we'll be funny, and so it'll be like a nice little stand-up comedic routine. First, I'm Michelle Schemerge. I'm the CEO and founder of Remote Health. We are actively rebranding into Equity Health, mainly because of the lessons I learned over the past couple of years. But I am a nurse by trade. So I am a geriatric nurse practitioner. So I have spent my entire 16-year career caring for older patients. And it really was clear to me that older patients wanted to be home and not, in fact, in a bricks and mortar location. And so in the year 2018, I told everyone, someday people are going to be afraid of the hospital or the nursing home. And everybody said no. And I live here in Charlotte, and so I could not get the behemoths here to listen to me. So I ended up starting my company in Greensboro, North Carolina. But anyway, we provide really consumer-centric healthcare to older patients in their homes, anywhere from primary care all the way through acute care at home.
Good afternoon, everyone. I'm Bryan Dennstedt. I am a fractional chief technology officer with a company called TechCXO. We provide on-demand fractional executives across a wide variety of places. My background's been in healthcare for probably over 15 years now. I started out way back when with IBM and worked on a couple healthcare projects, and then got into emergency department software, worked with that, and then I was able to join this crazy new thing that started about 10 years ago. Telemedicine really took off. So I was the CTO with MD Live Telemedicine. That was probably the number one or two big player in this space for the past few years. And then recently I joined TechCXO about 6 years ago, and I've been blessed to work on a ton of healthcare engagements and startups. And so I'm excited to bring a lot of healthcare technology nerdiness to the table, and I'll try my best to keep up with the jokes.
We'll see.
Awesome, thank you. We'll start with you, Michelle. What areas of consumer-centric care do you believe are most lacking in healthcare today, and how do we address some of those gaps?
So I think in healthcare, and I spend a lot of time thinking about this, my doctorate is in health policy, and healthcare is incredibly unique and complex because our consumer is not the patient. So the person who pays me is not my patient. That person is the payer. And oftentimes the priorities are really competing of who is providing good quality care, what is the definition of quality, all of those different things. And then I think that the second thing I would like to highlight is that patients believe healthcare is free. So particularly patients who have a lot of needs, have a lot of healthcare needs, chronic illness, people are shocked to know that healthcare is not in fact free. And so, as long as patients believe it's free, we're going to have a really huge issue with patients wanting to buy technology in order to perpetuate their health. And then the other problem with that is that they will spend a lot of time, that the people that do buy into technology or things that are consumer-centric will really create this further exacerbation of people who have good health and good outcomes versus people who do not. And really the people you need to be targeting are the people who do not have the ability to actually get good food or good healthy food. They don't even know what good healthy food is. And so they don't even have time to really figure out what is it that we need in our daily lives that will help us be healthy. And that's because our system is really oriented around sickness. So we spend all of our time figuring out how to really innovate sickness, but we don't know how to innovate health. And so I think there's a lot, really to be desired.
Awesome, thank you. Bryan, you have a deep expertise and domain knowledge in the technology space, both in healthcare and non-healthcare. What are some best practices that you think our healthcare industry today, whether it be the provider space, the payer space, or the tech space, can take from other industries?
Yeah, I think it's a really interesting question because I think it comes around with the fact that almost every place else we go for customer service, it's rapid and we get an update all the time and stuff, and yet we come and we wait at the doctor's office, or we have to wait in the room itself, or we have to go to a separate place for the medicine on that front. And so I think there's just a ton of workflow value things that we can do to shift the healthcare back into the same thing we get from our HVAC or a night out at dinner on that front. So every place you look, you can see innovation happening in other spaces, and we just have to figure out how to translate that into some of the processes with healthcare on a ton of fronts.
How do we keep innovation? How do we keep consumer-centric innovation sustainable? And I'll open that up to both of you.
You want to tackle it?
Yeah, I mean,
I'll follow.
on the sustainability side, I think, as any company comes through its maturation process, it has to always look towards serving the profits and some of those things. So I think that the sustainability comes from the bigger companies recognizing that they need to carve out a little bit of money for the R&D and for that innovation, and they need to fund smaller companies or some of the great ones in the demo hall over here and figure out how do we experiment and are okay with losing a little bit of money here and there to try and push that innovation forward. There's just so many amazing ideas that I see on a regular basis as a fractional CTO now, that the smaller companies coming to us saying, this is my great idea, I need some funding. How do we match them up with the right people in the big space that are willing to fund that, incubate it to a point, and then purchase it or acquire it or nurture it through? So I think that's a real key, is letting the bigger companies figure out ways to be aware of it and help fund that, and that can help feed that sustainability.
Awesome. Michelle, shifting gears a bit, you have a clinical background. So talk a little bit about when you were starting your company, how did you bring some of those clinical workflows into your company when you were starting it up, thinking through the pain points from a clinician's perspective and how do we match that with what the patient's needs are?
So I think this is a huge opportunity in healthcare. So one, healthcare is largely driven by females, clinicians. We're 91% female. And then consumers of healthcare are also majority female. So most people, as we just heard the statistics on the last panel, believe that that their health is great. Like I can have a patient that'll come into me and have 16 chronic illnesses, but they will be like, oh no, I'm great, I'm healthy right now. And so I think it's really important that we have to figure out who that person's caregiver is, who's the person that's gonna actually step up one day when they really do have a crisis, and figure out how to really care differently. But as far as my current work goes, we tackled the problem which may be amiss potentially from a solely clinical angle at first. So how would we create clinical processes that made clinicians really excited about coming to work during a global pandemic? Which is really, really difficult. And I had the extreme fortune that I went to college with a gal who was studying in Wuhan, China. So before everybody else, I got a call from my buddy to say, dude, this is intense. Like, we've never seen the likes of this in our lifetime. You're about to work as hard as you've ever worked. And fortunately, I heeded that advice. And she told me I needed 3 things. One, I needed 3 masks per day. So instead of an N95, she said, wear 3 masks, like your normal surgical masks. And then she said, early steroids, get as much early steroids as you can, buy steroids in bulk. And then the third thing was oxygen. Find a way to get oxygen as quickly as possible. And so we did. And so we figured out a way to really provide really consumer-centric care during the darkest days of the pandemic. When I was traveling around from house to house, not a soul was on the road as I'm preparing myself kind of mentally for what I'm going to see next. And I couldn't find anywhere to like go to the bathroom. You know, I mean, there was really, really big, complex problems, but the world had completely shut down in the face of this pandemic. And so I think that we listened to our clinicians, we listened to what they needed, we listened to all the people that were scared to death of receiving healthcare going out of their house. And so we really kept thinking about it from a clinical perspective and not a how much money are we going to make perspective. And I think there's a lot out there right now on, there's a whole New York Times expose on profits over patients. And I think that this is a really big phenomenon in our healthcare system. We used to be driven by mission, right? These used to be mission-driven organizations. These used to be organizations with charity to their core. And we used to deliver care to the most impoverished, the most needy, the most underserved people, and we felt awesome about it. It's really cool stuff. If you ever have the chance to do that, it'll change your life. So I got to feed people in the pandemic who were afraid. They were literally starving in their homes because they were afraid to go to the grocery store. And so, when you're able to do that, when you have the freedom to do that as a clinician, you feel great about your work. But we all too often industrialize healthcare to the way we don't allow for healing. We don't allow for connectivity. We don't allow for the emotion that is your healthcare crisis. And that's a huge issue. So I think we have to tackle it from a clinical perspective or we've failed, which is really what's happened present state.
Awesome. Thank you very much. At Novant Health in particular, we have I think several of you are aware of it. We have a dyad leadership model in place, both at the institute level and then also across several of our departments, where we partner clinical leaders with administrative, business, or technology leaders. And that way you're able to really make decision-making from not just a technology perspective, a business perspective, but you're bringing the clinical lens in as well. Bryan, from a technology perspective, provide an example or two of where consumer-centric care has worked really well, and it could be in healthcare or non-healthcare, and where it's failed, either from a product market fit or a consumer-focused lens. Just a couple examples.
I think, I just go back to that equation of we have to help solve some of these problems. How do we take a more holistic approach to the care and understand that, okay, yeah, I'm diagnosing your flu or something, but you also haven't gotten any food or whatever the example is. I think in healthcare, some of the best practices I've seen is just figuring out ways to open up that communication of we all seen the millions of appointment reminders and things like that, but how do we really know that that's not reality at times? Like, you're gonna run late sometimes, or there's gonna be a change in doctors or whatever, and how do we communicate those changes to the system? And some of the best ones I've seen are the ones that have figured out a way to adapt to those things, and they'll send out the notices that we are running a few minutes late. You don't have to rush to get here to this appointment, or it's okay if your doctor has changed. Here's this doctor, here's the new picture. You can look at their profile before you even get here on that front. So I've seen some of those little nuanced changes. On the worst side of it, I guess I point out the fact that, we're all super concerned about data privacy and the HIPAA compliance, and we don't want to get in trouble with the fines and stuff, but we are okay with the plumbers and the tree cutting guys and everybody else doing all the privacy stuff with our phone numbers and our personal information. So I do think I want to be 100% privacy conscious with everything that we build, and as consumers we have a right to privacy. I totally get all of that, but I do think healthcare needs to figure out ways to open up and be more like the Olive Garden or whoever with their beepers and stuff to help you serve people the right way, and break down some of those technology barriers and say, I'm okay with releasing this level of privacy stuff if it helps me have a much better and more streamlined and easier, quicker, better doctor visit. And then I think there's some major changes coming in healthcare around pricing and transparency to knowing who, we have to shift this model of healthcare isn't free, and the insurances are going to change, and how does that transparency work its way into the system in a big fashion, with knowing that an x-ray costs a lot of money and we have to figure out how we're going to pay this with copay, et cetera. So I think any other place we go on the planet, you'll get an estimate first, or you'll feel pretty confident with that estimate. And here it's always a post-fact here because we didn't know what your insurance would cover and that. And I think that's going to be a big shift that we see that's already replicated in other industries. So some good examples for us.
Yeah, is there a specific industry that you think we should look towards, that healthcare should model itself after?
I say the technology space in a big way. I mean, I'm a complete Apple nerd for those of you that know me here, but I do think Apple in their phone upgrade program has evolved continuously year after year. I know the first time I upgraded my phone, when they started offering that plan, it was a disaster. I was on the phone till midnight trying to get pre-approved or whatever silliness they're doing. But I think I just got the new phone. It came, and the seamless upgrade process and how quickly that came, and I was aware of the shipping process and just swapping out the old phone for the new phone. It was just extremely just well done, and very, very, very impressed with what Apple has accomplished there. So I do think there's a lot of technology examples out there of how do we transition people from an old thing to a new thing? How do we make them more aware of this and get better educated? Because we do have to switch from treating the injury you have to helping you prepare to not have that injury in the future at all. So there's got to be this contextual shift, and we can learn a lot from other industries that have done that. So I'd say the technology space primarily, but I've mentioned my HVAC guy a few times already. So
I'd like to weigh in on this one. Can I weigh
Yeah.
in? So I think our biggest problem is that we consider it to be an industry, an industrial, and healthcare is a service, and it's a really incredible, vulnerable space when you're sick. When you need healthcare is a really, really vulnerable, trying time. And so I think that if we continue to kind of further industrialize the space, we're just going to have robots. We're going to have what happened in the pandemic, right? So if you stayed in the ICU, hopefully none of you did, but here's what happened. So you get into the ICU, you're not allowed to have an advocate, you can't breathe. Hopefully we have a ventilator for you, although my lovely buddy from Wuhan would have told me, go avoid the ventilator at all costs. So anyway, you get to the ICU, your physician is virtual, and you have a nurse there with you. Your only lifeline to the outside world is a person in a hazmat suit in a time when you can't breathe. And so if we let healthcare get to that place, which it just got to, we're just going to see hordes of people die. When you're actually really sick. And it's a really, really scary thing. So I think we have to look to other industries from sustainability, but also compassion, and really challenge ourselves with what we are building. I think that, I'm often the only person who's actually cared for a patient in the last 2 years on a panel like this. And it's completely different than any other industry. So we have to really change our thinking around trying to just adopt best practices from other industries and really get to the heart of what we're trying to do. What is our goal in healthcare? Because if it's to increase profits, we're killing it. Let's do that some more. But if it's to actually heal someone or keep them healthy and prevent chronic illness, we are not doing that. And so, I think we really have to make some different definitions, but really challenge ourselves to think about it not as an industry, but as a service offering and a mission-driven entity and workforce. And if not, we're just going to really lose the people like me who want to do this work and feel called to this work.
And it triggers that's an awesome example, but there's even a simple example that popped in my head as you're mentioning that. Is just my daughter sprained her ankle on Sunday night before Labor Day. And so, okay, everything's probably closed. We'll see if it's, and in the morning it wasn't doing that good still. So here I am, Labor Day, trying to figure out what urgent care place is open. And I just go to my standard places like the Google Maps, whatever, and I find the 7 different urgent care places near me. And I don't know if they're open or not on Labor Day because they all say the standard hours from Monday through Friday. So are they open or not? I try and call. They don't answer the phone. I called some of the Novant and Atrium 800 numbers. I get a wonderful representative on the phone that says, yeah, let me help you, and compassion, all that stuff. And then they just route me back over to the phone number I was already on. So I don't know if the urgent care place is open. The only way I knew was driving to them and see the sign on the door that says, yes, we're open, or no, we're not. And I had to go to 3 of them because they wouldn't answer the phone. Just that simple equation of, are we open or not? And should I go to urgent care? Does you have the x-ray machine or not? Because some of them do, some of them don't. So it's just that simple point of need. But I can assure you that McDonald's and Chick-fil-A and all them updated their hours on all of the websites for whether they're open or not on Labor Day. So
if you were my patient, Bryan, we would have already been at your house, gotten you an x-ray in your home, and she wouldn't have missed a beat. She would still be playing with her toys.
Exactly. So
and your wife wouldn't have had to figure out how to really care for somebody differently.
That's right. That's right.
Or you could have called our on-demand virtual care department and they would have routed you. But yes, plenty of options there. So thinking through, you've spoken to it a little bit, but diving a little bit deeper into thinking about the inspiration list for innovation. When you go to look for new ideas that are, whether you're implementing them in your own business or applying them to clients, what's your inspiration list for innovation? What are the questions that we aren't asking, and how do you generate those ideas and questions?
Me?
Yeah.
I have a lot. And I'm talking into 2 sides of my mouth here because I have so many inspirations and none of them are from the healthcare industry. So my mother used to tell me that I was Jeff Bezos. So I have this profound belief that I am in fact the founder of Amazon. And like a millennial, I really believed her. I really thought that she was right. And so I have this really relentless pursuit of the patient. What does a patient need? How do you advocate for a patient? How do you give them all the tools they need to be successful with their health? How do you enable their caregivers, whether that be a mother or a daughter, or on the very rare occasion a son, all the people who really need to be informed about a person's health, particularly in my case. So my average age patient's 91 and they can't really talk to me anymore. So they don't, there's not a lot of cognitive abilities, and it's really difficult when you need somebody to help you navigate the system. So that would be one. I think that how do we stay in relentless pursuit of what a patient needs and what a patient wants, and we don't even think about it in the healthcare space. I've been at Novant twice, so I was a frontline geriatric nurse practitioner for Novant for the first 6 years of my career, and then I oversaw post-acute care for Novant during when we were really innovating with healthcare bundles. And you just bang your head against a wall that we didn't even think about the patient. We didn't even really consider what would happen to that patient after they left the hospital. And so then we started getting penalized for what happens to the patient after they left the hospital. So then we figured out how to fix it, and then we got in trouble because we stopped patients from coming to the hospital. And so it's really an interesting thing. But I think we have to stay focused on that. I also really love all the outdoor and sustainability things that are happening. So I love Patagonia. I love the story of Patagonia. I had no clinicians leave during the pandemic. So we had 100% retention rate during all of the 2 years that we were really churning along. And then the hospital we were partnered with decided that they no longer wanted us to prevent patients from being in the hospital because we did it so successfully. And so I had to lay off all of my family and friends, honestly. And that happened in Patagonia too. And so how do you really grapple with, not only did I just care for the sickest of the sick and the dying, and none of them died, by the way. So I asked for all the patients who we were going to ration care to. They sent me all those patients. We expected them to pass away because I could not stomach the thought of somebody dying alone. And then they all lived, mostly because I had a great buddy who told me early oxygen and steroids. How do you really grapple with those things? And then how do you create a really sustainable, beautiful story for the future, which I think healthcare is really ripe for. So those would be two of my examples.
Those are some great ones. Yeah, I would say probably traveling. I mean, it's just getting out and seeing how some of the other cultures around the world are handling the care models and stuff, because I think some of them haven't evolved as fast as we have, and some of them have way outgrown us. So I think going and seeing those firsthand, you'll come back with some really amazing ideas. I saw some amazing bathrooms in different airports and stuff, with just innovative ways to take care of the sustainability on the paper and stuff like that. So there's just so many different options. So I'd probably say that travel is probably one of the big ones for my innovation. And then I guess I love TED Talks, so I'm addicted to my TED Talks. So there's lots of amazing ideas on those as well. And I think almost every TED Talk could get turned into a business of some sort. So watch more amazing people get up and give us their ideas. So.
As we look to 5, 10 years down the road, what are you most optimistic about with regards to consumer-driven care? And then what are you most pessimistic about?
Oh, do you want me to go?
No, I can go first. I can talk all day about this. So to borrow from my favorite book of all time, I think it's the best of times and the worst of times. And so I think that there is so much opportunity as far as consumer-centric care. But I think that there's a lot of problems that come with that. What we're starting to see is patients beginning to pay for their health care, particularly ones who can afford it, and they're bypassing insurers. And the problem with that is that we're no longer really gathering data on those patients. They become like a black hole of sorts. And so by time you really crop back up to a specialist or have a bigger need, nobody has any idea what's happened to you in your healthcare. And so, and then how are we even going to, figure out how to actuarially decide how much you're going to cost and how much risk we're willing to take on you and all those different things. So I think that there's a lot to be solved for, but I think that it's a really, really good time to be in innovation in healthcare, because we've seen it's just broken. I mean, there's so much to improve on. So I think I'm most optimistic about the potential, and I would love to blow up our healthcare system. I was sitting, I do a lot of talking to elder communities and communities where people are aging and how can they age in place. And at a very fancy one here in Charlotte, I had a man genuinely tell me that his retirement plan was to move to Italy because of their healthcare. And I really thought about that for a really long time. Like, what? That's during the pandemic, Italy's all over the news for how horrific their healthcare response was. But they have incredible safeguards for older patients. And so his plan is to literally move his entire he's trying to figure out how he can get even his loved ones, even his children and their children, to Italy. And I think when we get to that place, our system has been disrupted a ton. And so I think in times of disruption, some of the greatest innovations and some of the greatest change comes about. So that's what I'm most optimistic about. I am most pessimistic about the people driving the change currently are most incentivized to keep it the same. So how do you really change that conversation? And I spend a lot of my time thinking about this. And if you've got any ideas, please let me know. Maybe in our Q&A, you could give me some thoughts on that.
Yeah, I mean, it's powerful. I guess I'm the computer geek up here, right? So it's about that gathering of that data. I just think it's going to get even better. The watches and the stuff that we can wear, the stuff that's going to get built into our clothes, that combined with, virtual reality and being able to let the experts be any place on this planet, and we can instantly have them at our fingertips or in a virtual reality headset is just going to be extremely powerful. So I'm just so excited to see that continue to grow and expand. But to your point, the reimbursement and the cash flow pieces of this whole thing are very broken, and we've got to drive forward that transparency. We've got to make people aware that eating healthy and exercising, those things will prevent a lot of the things. Sleeping well, exactly. So we've got to go back and re-educate people that it costs money and you have to take care of yourself. You can't, there's not going to be any magic pills for us in the future. So those are some big things that are on my pessimistic radar that I hope we can get through to people. So.
Awesome. Thank you, Michelle and Bryan. We have a few minutes left. We'll open it up for Q&A.
Not everybody all at once.
Okay. All right. Thank you so much for joining us today.
Thank you. Man, it's like a